Good day. Introduction. COVID-19 has impacted hospitality particularly hard. However, there's some options available to those who work within the industry. We run through the implications for business and the opportunity moving forward. COVID-19 is a health pandemic that recently brought the world a standstill, but will exactly it is. According to Department of Health, COVID-19 originated in Wuhan, China, and is respiratory illness caused by a new virus. The DOH has advised that the common symptoms of a COVID-19 include fever, coughing, sore throat, fatigue, and shortness of breath. And the reason through direct contact with the person who infected with COVID-19. 2. Through contact with the infected person who caused or sneezed without practicing safety practices, and by touching objects surfaces that had been contaminated by infected person. Challenges. When looking how fast the virus can travel, the first we documented in December 2020. By mid-April, and there were over 2.57 million confirmed cases and 177,602 deaths across the globe. Due the pandemic, COVID pandemic, cafe-like food industry has been affected globally because the government restrict food services operating to slow down the spread of the virus. It also affected the cafe raw materials, transfers of goods and deliveries, as well as the momentous shifts in demand. Most of these disturbances are a result of a policy adopted contain the spread of the virus. The impact of COVID-19 still unfolding. Experience so far shows the importance of an open and predictable market environment to ensure food can be moved to where indeed. The biggest risk of food security is not food availability, but the consumer's access to food. Safety nets and are essential to avoid increase in hunger and food security. Solution. Cleaning and disinfecting cafe room will require us to develop our safety protocol plan, 2. Implement our safety protocol, and 3. Maintaining and revise plan unnecessary. Reducing the risk of exposure to COVID-19 by cleaning and disinfection is important part of reopening cafe room. Will require careful planning. The virus that can cause COVID-19 can land on a surfaces. People can become infected if they touch those surfaces and then touch their nose, mouth, or eyes. In most situations, the risk infection for touching a surface is low. The most reliable way to prevent infection from surfaces is to regularly wash your hands or use hand sanitizer. Always follow the standards, practices, and appropriate regulation specific to cafe room facility for minimum standards for cleaning and disinfection. In an effort to reduce spread of the virus and reduce the risk of your customer and staff, you will need to consider things like: number 1, social distancing; number 2, wearing of face masks; number 3, staff vaccination requirement; number 4, available and hand sanitizer for staff and customers; and lastly, safety protocol signages. Benefits. Safety procedures are important internal control. Cafe-room use of safety procedures employees does not injure themselves or customer during business operations. Also will number 1, improve the productivity of staff through fewer sickness absences, cutting the healthcare cost of the business, stimulating and more efficient working methods and technologies, and lastly, reducing a number of people who have cut their hours to care for a family member. Results. Implementing the safety protocols resulted in a limited risk posed by COVID-19 disease as much as possible because there has been no prior official documentation of a safety plan in Kafriru. This safety plan will also serve as a template for other safety plans that Cafe will have in the future. The next important step of safety plan is continuously implementation. With approval from the law owner and the safety plan details will be presented to all Cafe staff with proper training and help for the management. As the pandemic continues and there no certainty whether the situation will be better or worse, more new regulation more introduced by the management in the future. Thus the content of the safety protocol plans to be continuously updated. Thank you.